As unavailability of personal protective equipment among healthcare workers continues to become a norm, a stock of COVID-19 response kits worth 6.4 billion shillings lays in KEMSA's warehouses.
Until I saw the letter from my colleague from the National Treasury, I had no idea that this matter was of this magnitude.
The matter took center stage in a meeting between Ministry of Health officials and the Public Investments Committee, with the blame seemingly lying squarely on KEMSA.
All these items that they procured at the higher prices cannot be sold or could not be sold without approval. So those stocks are sitting there. You don't spend what you don't have. Whenever you procure, you must procure on the basis of available funds. So, that is the one fundamental principle.
Of the monies allocated to COVID-19 response, the Ministry of Health is said to have outlined a budget of 758 million shillings. KEMSA, however, went beyond and purchased COVID-19 related items worth 5.1 billion shillings.
758 million PS that you confirmed. This money is paid by Treasury, right? As you said. How much of that has been paid?
Chair, to date, we have not paid more than 350 million.
Exactly. So what that means is these guys committed themselves for more items, not on the need basis, but on the greed basis.
According to Health Principal Secretary Susan Mochache, this transpired without the knowledge of the Ministry of Health.
You can see the management trying to look for money retrospectively. They've committed 5 billion, then they've written to the National Treasury seeking for money. We have no idea, the Ministry of Health.
The controversial conversations around the Jack Ma donations could not escape the dialogue at Parliament.
There is a lot which is being talked in the public domain about this issue of the Jack Ma donations.
Members of the committee sought clarification on the transparency of donations, where Mochache family confirmed that all received equipment are being utilized accordingly.
Let me assure this House that we have distributed. I'm under a lot of pressure even from, governors calling. They have a lot of burden. So I cannot sit on the goods. You can't. Not when you're in health. Kenyatta is calling. Madare is saying they don't have. So as they come, we start distributing. In fact, there are cases where when we get the details in advance, the distribution is ready so that the goods arrive and get disbursed. So the rumors go on and we really cannot manage our affairs based on what is out there.
National Assembly Public Investments Committee members now want action to be taken against the rogue operators at KEMSA, with the aim of eradicating barriers of quality health service provision to citizens.
Someone must have had a huge level of courage to go against all odds.
Don't you have some authority that you can ask that CEO, call for us a special board so that we can review what you people are doing?
Ben Kerera, K24, Evening Edition.